Good evening, everyone. I'm Dr. Charlene Brown from CNA Simulations VR, and I'm here and excited to introduce you to the 7th webinar in the Maryland Emergency Preparedness Network's COVID-19 2020 webinar series. And we're really excited about today's webinar on PPE. Show me yours and I'll show you mine. We have Celeste Wooten, who's a CNA, a certified medical assistant, and a certified palliative hospice nursing assistant, among many other things. And she is going to be our featured speaker today. We're gonna dig down and do a really interactive session with you. So I introduced myself already. As always, we are here because the Office of Preparedness and Response at the Maryland Department of Health believed in this vision. Maryland's National Capital Home Care Association, MNCA, is the lead on framing these webinars, and we are partnering with them to bring them to you. So we want to thank the Emergency Preparedness Network. And if you haven't joined it, you can go to this website and sign up anytime. If you're a home care agency in Maryland or DC and you're not a member of MNCA, this is your chance. Just go to mnca.org. And of course, there's my company, CNA Simulations VR. Learn Care Together LLC, which is the company you've been hearing about through all these webinars, has a new trade name. And so this is what we're going by now. We have quite a winter slate of webinars coming up. So next week, Thursday, a week from today, at 4 p.m., we're going to dig deep into social isolation and loneliness among older adults during COVID with Dr. Abrams, one of my former professors from med school. We have Dr. Beth Gaelic, who you may remember her from the dementia presentation in August. She is doing a webinar on stress management for home care clinicians during COVID. She's a nursing professor at University of Maryland. We have Dr. Luke Cobb, who's going to be talking about mental distress among children during COVID. And the content of that webinar should be cross-cutting enough that for those of you who just have children, it might actually be really relevant, although our focus is on children needing care. On December 10th, one of my favorite people, Linda Tedosio, is doing a webinar on post-COVID clinical considerations in the home, and I want to highlight, I'm super excited that we have physical therapy representation among the speakers. And guess who's coming back on December 15th? Dr. Abrams. When we were talking to him, we had so many ideas that we just locked him in for 2 webinars. He'll be talking about caring for older adults with COVID. So Dr. Tedosio is doing post-COVID, he's doing with COVID. And finally, we have another CNA presentation on December 17th from Ama Depa Grin, who I have known for 5 years now. She is a phenomenal presenter. You might remember her from the July webinar. Caring for the caregiver, perspective from a CNA. All right, that's what's happening. So if you haven't signed up, literally just go to the website and sign up for them all. We'll see you in the coming webinars. And what's even better is that we have more that aren't even on this list, so stay tuned. Now I'm excited to introduce you properly to Celeste. She's been a hospice certified nursing assistant for over 20 years, but I met her last year at the conference for the National Association of Healthcare Assistants, NACA, in Arkansas. And I just had such respect and admiration for her at that time that we kept in touch. And she is one of the most accomplished CNAs I've ever met. So not only is she a CNA, a medical assistant, certified hospice palliative nursing assistant, but she is involved in so much CNA leadership. She's on the steering commission, the CNA steering commission for the National Hospice and Palliative Care Organization. She's on the board of directors for that same organization, the National Association of Healthcare Assistants. And if you're a CNA in the audience right now and you're like, ooh, I wish I had a professional association I could be a part of. Well, there is actually one, the National Association for Healthcare Assistants. And if you Google NAHCA, N-A-H-C-A, like you'll find them and you can join the community. At work, Celeste is the senior CNA lead for Intrepid Hospice of Virginia Beach. Being the senior CNA lead means that she is responsible for a team of CNAs, and she has had multiple occasions of training, giving feedback, overseeing their engagement around PPE. She even has a role in terms of thinking about how PPE needs will evolve over time, and they are gearing up for winter and the rising burden of COVID-19. Beyond her CNA leadership, Celeste has a wonderful husband, 3 children, 2 grandsons, and really is a career CNA who has a sense of commitment and ministry to her patients. And like I've really been impressed with her level of drive and sense of commitment and mission to being a CNA. And I just want to celebrate her. And I really feel like we're lucky to have her today. And so with that, after my admiration song for Celeste, we're going to take a moment and actually do a poll that Celeste has asked us to run. And after the poll, we'll hand it over to her, and just stay tuned. I hope you're on the edge of your seats and ready. Here's the poll. It's a really easy poll. I have a feeling that a simple yes or no question, I think we can probably wrap it up at this point. What do you think, Nasen? Okay. Yes, fantastic. All right. That is good news. So now I'm going to stop sharing my screen so we can see Celeste's beautiful face and hand it over to her.
Okay. Thank you. That introduction was woo, felt like I won an award or something. I should be going like this.
We could have had like a clapping track in the background, but we
thank you. I am so glad to be able to share with everyone. As Dr. Charlene stated, I am a longtime CNA. My passion is CNAs. My passion is also empowering CNAs to make sure that they understand the value of what they do in our community with our senior population. The reason that I chose to talk about PPE is only because this pandemic has opened up a lot of uh-ohs in our ALFs and our skilled nursing facilities. It's kind of peeled back the layers of things of not knowing how to properly wear PPE, down to not having enough PPE to get through this crisis. And it's actually led, unfortunately, to death of some of our healthcare workers that are in this pandemic working. And I just want to take a moment to anyone that is on this webinar with us this evening. If you do work in the direct care with the patients and residents, I want to personally say thank you for all your hard work. Thank you for everything that you do. And please know that you are very, very important, which is why we want to talk about the importance of having proper PPE for you and to make sure that it is being worn correctly to protect you, but to also empower you to let you know that you are worth every piece of PPE that you wear that is needed to take care of your patients and residents. For those that I'm sure everybody knows what PPE means. It is personal protective equipment. It is very important to know that although we wear PPE in the building, protection outside of our buildings is very important as well. So we want to make sure that we're wearing the face coverings when you're out, when you're not in your buildings. Washing your hands or using the hand sanitizer if you can't wash your hands. Just making sure that even though you may not be at work, that protecting yourself does not stop at your job. It goes outside of your job as well. So we want to make sure that we're doing that. I wanted to talk to you about basically knowing that PPE is designed to be used one time only. It wasn't designed to be washed and sprayed and and reused. That's not what it was intended for. And I want to empower you that if you don't feel like you have enough PPE to take care of your patients or your residents, speak up. Speak up and tell your DONs or your admins, because along with keeping your residents and your patients safe, you want to keep yourself safe as well. And that you hold that responsibility to make sure that you have everything that you need. It was funny because I was teaching the girls that I work with, and we were talking about donning and doffing, and they kind of looked at me like, who and who? And I said donning and doffing of PPE, and they didn't really understand what I was saying. And so basically I just kind of, said donning is putting on, doffing is taking off. And I was trying to get them to show me how to properly put PPE on or properly take PPE off. During these times of this pandemic, we want to make sure that we are, A, using our PPE correctly, and 2, we're being good stewards of our PPE, which we need to make sure that, we know the times that call for, everything from head to toe versus, the gowns and a mask and the gloves. And we're going to kind of do a quick synopsis of how to put on the PPE, how to take off the PPE. But I wanted to make sure that we understand that this disease, this virus doesn't have any names. It doesn't discriminate against any place of work, any residence, any age group. It's just running rampant. And as healthcare workers, we need to make sure we do our part in making sure that we protect ourselves and the people that we take care of. We know that COVID is transmitted with droplets. We close up on each other, talking, coughing, sneezing. So I want to make sure that with what we talk about with the wearing of like the cloth mask, or if you wear the little blue surgical mask and stuff like that, that we're making sure that we're wearing it the right way. And again, we'll go over that. I know during this time, rules change from day to day with the CDC changing different things because of the ongoing research that is going on. I can just say for me that I want to make sure that anybody that is in my profession is protecting themselves, has what they need, is wearing it correctly, and disposes of it correctly as well. And that we've kind of become complacent lately, because the virus kind of took a lull a little bit. And I've started to see people, either not wearing the mask, or they're wearing the mask like hanging off the ear, or they're wearing it down here, or I've seen different things. So we want to talk about best practices to make sure that we're keeping everybody safe. We're keeping you safe, and keeping your residents and your patients safe. So I wanted to talk about just really quick, the types of PPE, which everybody I think knows, but just to go over, are your gloves, your mask, whether it's surgical or the N95s, your eye protection, your clothing, which is gowns or the head coverings and shoe covers. I personally went on Amazon and was buying masks and safety glasses and anything that I could get just to have for myself. Even though your where you work, your employer and everything. They should provide that. But I am just a proactive person, and I just want to make sure that I have what I need for my team, for me, and for anybody that would really need it. So we're going to kind of go over the different pieces. I'm sure everybody knows this, but just in case, I just want to make sure I go over all of the things. As you can see, I've got on my blue hat. Behind me is our gowns that should be thrown away after each use. We have our mask, the surgical mask. We have our N95, and we have our gloves. If I may say, as much as I love the acrylic nails, and I used to be a big wearer of acrylic nails, I miss having my acrylic nails and being girly. But I'd rather be short nails and clean and still doing my job. The acrylic nails are not a good thing to have right now. You're constantly washing your hands, and everybody knows with the acrylic, it around your nail beds, it will start to rise up, or as your nail grows, it starts to come up as well. And unless you're walking around with a nail brush for every time that you wash your hands, you're getting germs, bacteria, anything can get up under there. And not only that, when you put on gloves and you have on the nails, you run the risk of your fingernails going through there. I love to wear, I don't like taking this off. But again, unless I got something to scrub it, and then when I put on my gloves, I've had it happen numerous times. I've been in a hurry and I'm putting them on, and my ring will actually tear through the glove. So again, you want to make sure that you know, just a side note, as much as the nails are pretty right now, I just would not advise having them on just for germs and bacteria purposes. And also, going back a little bit, I actually asked this question to someone and they kind of looked at me strange when I talked about it. I said, how often should you wash your hands? You're dealing with a resident or a patient, if you're getting ready to give a bed bath. And she, you know, she explained to me, I do what I do and take it off and wash my hands. And I said, okay, and I said, but you should wash your hands before you put your gloves on. Put your gloves on, do your task, take your gloves off, wash your hands again. And it's just little basic things like that, you know, could mean the difference of you possibly getting something, transferring something, little bitty idiosyncrasies like that. So we want to make sure that we're washing our hands. Invest in some good lotion, I will say, because you're going to be washing your hands a lot. I have these type of safety wear glasses. They're not very fashionable, but they do the job. I know that some people that wear glasses, some can get the ones that can fit over their glasses. I wear glasses myself, but I can't have two pairs of glasses on. So what I normally do is if I have to wear my glasses, I will have my shield on. So my someone just asked me a question. My glasses, I actually got them from a scrub store that is here in Virginia Beach, but I believe you can order them off of Amazon. I actually ordered a couple more today. The N95 mask. These masks right here, yes, they're hot. Yes, they will leave bruises on your face. One thing I will say with these, I don't have time to do the makeup thing anymore, because by the time I put these on and then I have the mask face, and then of course everybody's getting the famous, as they call it, the maskne now. And it is happening. So you want to be careful, because again, you have to be good stewards of the PPE that you've been given. And so if you get makeup and all that stuff inside of these, then that gets all nasty. And then, if you're having to put these back down in a bag, because I don't want to go against what anybody's places may be telling them, but if you are having to reuse these, if you've got makeup and lipstick and all that stuff inside of there, that's just ick. And you don't want to put that right back on your face again for the next day. This is the surgical mask. There's all different kinds, but this is normally what you see everybody wearing. And again, the same thing applies, that the makeup, and you're putting these on. And then I toss these. I'm just gonna say it. I toss these. I just wearing these over and over and over again. I can't do it. I toss these. Some people are being asked to wear the face cloths. The face cloths, if that is what you're being asked to wear, please, 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 please wash it every single day. Do not wear it 2 days in a row. Do not wear it 3 days in a row. If you can, get you a collection, like a week's worth, and every day you just wear a different one until you get to the last one and you wash them, however you want to do it. But please do not wear the same cloth every single day to wherever your building is, because you're just bringing back in whatever's on the outside of that. So I have shoe scrubs, or the shoe covers, but some places are not making you use those. Some places are. We do, only because I go into some patients' homes, and then I also go into buildings as well. So we actually do use the shoe covers. So we're going to do a little bit of the donning. And so first you would do is your gown. And I'm just going to kind of be in the chair and do this, but you would put this on. And I want to make sure that I emphasize this, the tie goes in the back. It does not go in the front. So you'll have this on. Then you will do your, either if you're going to wear this mask or this one. And I'm just going to do this one for right now. And please note that I'm not wasting PPE. This is all my personal PPE that I keep on hand when I do these, so that I'm not wasteful. So please don't think I am being wasteful. So you will do this. You will make sure that this is around the bridge of your nose. And this is under here. Then the next thing, you will either have these, which is my preference, or some people actually have this, would go like this. And in some places you are required to wear this and these. So it goes by whatever your building's rules are. Then the next thing would be your gloves. And then after that, so doing this is a no-no. You do not touch your face. Everything that you're touching, it's whatever you're touching is going to become contaminated. So I mean, you're doing things with the patient. So you just want to be careful about touching everything. And then I've seen people go like this to try to get their glasses up. just be mindful to just try your best not to touch your face like that. So taking off, this is a very important part of the process, because you've been in the room now, you've done what you needed to do with the patient. So taking off is to me, because you've become contact now with everything, this is like a most important part, to make sure that you're taking it off the right way. So first, you would take off your gown, and normally I would untie it. You would take your gloves, and then you would do the same arm and take your glove off that way. You would ball this up, and then you would dispose of it. The next would be these, or your face shield if you had a face shield on. Then you would do your mask. Then you would go and you would wash your hands. Scrub them, wash them, scrub them, wash them. Just keep sing happy birthday is what I tell everybody. Just kind of sing it and do the scrubbing, the nail brush. Make sure you get a paper towel to turn off your water. Then throw your paper towel away. So if you can't if you're in a place where you cannot wash your hands, use the hand sanitizer, but as soon as you can possibly wash your hands, go ahead and take care of that and wash your hands. And I think I'm going to pause for a minute, because I think Dr. Brown had a couple of slides that she wanted to try to show, and I wanted to give her an opportunity to show those before we kept going.
Okay.
Because I liked your slides so much, I wanted to just make sure we used them. I was like, I like those.
Let's use them. They were optional, but now we're gonna put them in.
I want them.
All right, we're bringing them. We're bringing the slides. Give me 1 second. And by the way, great job so far. If anybody has questions, whoops, wrong slide. If anybody has questions, please go ahead and put them in the Q&A at the bottom of your screen. Okay, so, all right, so the slides that I put together are really about doffing. I spent some time looking at the research literature to figure out what the science is saying about the risk of contamination when putting on and taking off PPE. And it looks like people make the most mistakes when they're taking off their PPE. And that's disturbing, because that's actually when you actually have virus or whatever the infectious organism is that you're wearing PPE to avoid becoming contaminated with. Now that you've put on your PPE, you've taken care of the resident, your home care client, whoever it is, and now you are contaminated. If you don't take off your PPE properly, if you don't doff your PPE properly, that's when you actually are risking contaminating yourself. So you can get viral material on your clothes, you can get it on your skin. So donning and doffing matters, but doffing really matters. It's the highest risk part of engaging with PPE. And the other challenge is that you get really tired. By the time you've worked and you've taken care of someone, you're just exhausted. And it's very easy to just kind of want to rip that stuff off and get going. But that's the time where you have to be really deliberate and careful and do it slowly. So there was a study at the University of Pittsburgh where they videotaped people gowning and gloving, and they found that 80% of people were self-contaminating themselves. These are some of the most common doffing errors that I found across a bunch of different research articles. One is, Celeste really just highlighted the importance of washing and washing again and washing again, minimum of 20 seconds. And it's not just, like run your hands into the water with a little bit of soap. You really have to wash all of your hands, your wrists, work on your fingernails. Like it's really important to wash your hands. Too vigorously removing the isolation gown. So if you just like want to get it off, you're shaking up all that virus, right? Like you can actually get virus on your clothing. Removing your gown at the wrong time is also another common mistake. Touching the inside of your gown or glove with your gloved hand that is contaminated with virus. Touching the outside of your gown or glove with your bare hands, another mistake. Touching the side edge or front surface of the face shield with your gloves. Not untying the upper, like when you untie the upper straps of a surgical mask, the mask that Celeste had didn't have the ties, but if you are tying, if you have the type of surgical mask where you are tying it and you just untie the upper straps and let it fall down, now you've taken a mask that might have contamination outside of it and you've plopped it onto your clothes. And so you're contaminating yourself. And again, too vigorously removing your gloves, not peeling your gloves away inside out, as Celeste was showing you. These are some of the most common doffing errors. And these are the things that put you at risk of actually becoming exposed, whether it's to coronavirus, C. diff, MRSA. There's so many, like beyond the pandemic, before and after the pandemic, there's so many reasons that we wear PPE. There are few infections that require us to wear full PPE, but regardless, these rules apply because all of this research was done, the majority of this research was done before the pandemic. So these were problems that existed even before the stakes were so much higher. I think I'm gonna stop there and hand it back over to Celeste. If we wanna talk about masks and aerosols later, we can, but for now I'm just going to stop sharing and hand the reins back over.
Okay, so I think one of our questions is, when do you take shoes off? When do you take off shoe covers to avoid contamination on your way out? Oh, okay. Well, with me, when we do the shoe covers, I kind of take everything off. Like when I take off my gown and gloves, I kind of bend down and with the gown and all that stuff rolled up and take my shoe covers off with that and throw it in the trash. That way everything dirty is going into the trash. But Dr. Charlene might have a different way to do it, but I just figure since that's a dirty thing, take it off and just dispose of it at once.
Whoops. Yes, that doing it at the end is
yeah. Okay, and then it says some facilities ask staff to leave their PPE in the room and use them only when they come in to help patients. I personally do not feel comfortable with this. What are your thoughts on this? And does it contribute to the spread of germs? I 150% agree with you. I think you should do your PPE before you go into a patient's room or resident's room. Because leaving it in the room, to me, if someone has got something going on and you're trying to be protected from it and you're leaving the PPE in the room, you're kind of contaminating it. So I would want my PPE on the outside of the room, put it all on, then you approach your resident or your patient with the PPE on. So I agree with you on that. I think that's not the right way to do that.
Just one thing to also invite when people ask questions, if you could identify what you do, like are you a CNA, are you an agency administrator, are you a nurse? Let us know a little bit about who you are as well. But there's one more question there, Celeste.
Uh-oh, sorry. Our gowns.
I think you answered that. Yes.
That's a negative. No, yeah. You should not reuse gowns. They are intended for single use only. When you're done with the patient or resident, sorry, I deal with patients, sorry, it's hard for me to get out of that patient. But when you are done with your resident or patient, toss it. That's what it's designed for. It's one-time use, throw it away. Please do not put a gown on and go from room to room. That is spreading whatever's on your gown to the next person that you went to. Once you're done doing what you have to do with your resident or patient, take that gown off properly, everything else, roll it up, toss it away. Is double gloving necessary? Well, truthfully, I say no. If you're doing everything right, no. But some people, it gives them a false sense of security to do the double gloving. I can't do double gloving. To me personally, it cuts off my circulation. I can't feel anything. But to me, it's kind of giving you a false sense of security because you're thinking, oh, I've got 2 pairs of gloves on. I'll be okay. Nothing will happen. No, you do your one glove and just follow your steps. Really, that's all you can do with that.
And just to piggyback on Celeste, the CDC does not recommend double gloving.
Yeah.
But we have some questions in the chat too. So first of all, someone wants your glasses. They're like, what's the store? Tell me where you got them. So if you could, we can, I don't know, like, do you know it offhand, like the name of the store, or do you need to look it up and we can?
It is called Jeunesse, Jeness, I believe it is. Jeunesse Uniform Shop in Virginia Beach is where I got them. And they actually, I have 2 other colors. It came in pink and green too. So I have 2 other colors. So yeah, that's where I got it. Jeunesse Uniform Shop. You're welcome. I agree. Sometimes the gloves are too thin. Truthfully, with the I forgot what they're called, and I don't have a pair in front of me, but they're the clear looking gloves that a lot of buildings will use, and they'll say the powder free gloves, and I have a pair somewhere in here, but to me, I've heard, and I want Dr. Charlene to correct me if I'm wrong, that those gloves should never be used because of, you should be using the nitrile gloves when you're doing like changing someone or something, because they were saying that the other gloves that is like clear and see-through that a lot of buildings use sometimes because they're cheaper are not the correct gloves to use. And I didn't know if that was true or not. Somebody asked me that today and I was like, this is the first time I've ever heard of that, but.
They should be using medical grade gloves. Like it's not, not the gloves you use to scrub out your tub or the gloves. Like it shouldn't be, like, I can't really tell what kind of gloves you're describing, but it should.
I don't want to step away and get them, but.
Yeah, but they should be designed for clinical care. And so latex gloves are a good example. Some people have latex allergies, and so there are other gloves that have been designed for people with latex allergies,
Right.
without knowing the specifics. But there are some really thin gloves that are not meant for caring for people who are sick, that may be used for household purposes or for other purposes.
Right.
It like definitely should be
okay.
medical grade gloves. So.
Someone said, do you use reusable shoe covers? I did not know there was some. I only use a disposable, so I don't think, no, I wouldn't. I just couldn't do that. And it says, my company offers washable gowns. Is that okay? Okay. My company actually has those as well. And what they were doing was, we had those when everything started going crazy, when this virus first started happening, and we couldn't get gowns, we couldn't order gowns, we couldn't find gowns, but we could find the washable gowns. So we used those. I mean, it just had any amount of protection. The only thing that I can offer you and tell you is, if you use those, please, please, please be very careful with how you're taking them off, and making sure you're taking them off just like you would the regular disposable gowns. We want to make sure that, with that fabric, we don't know if that fabric is, holding in anything. And if you just kind of go like that to take it off, because you're thinking, oh, it's a washable gown, I'm just going to throw it into the, no, you actually need to take everything off if you're going to use washable gowns, just like you would if you had the disposable gowns, making sure you're removing it the right way, rolling it up, folding it up, and disposing it wherever it is you guys need to dispose it for it to get washed.
There are guidelines, to piggyback on what Celeste is saying. There are guidelines that have existed for a long time about how to use PPE and how to dispose of PPE and what's not reusable. But in the context of the pandemic, there had the NIOSH, the National Institute of Occupational Safety and Health, has come out with recommendations for preserving PPE. And so there are certain things that facilities are now permitted to do to optimize their ability to keep using PPE in the context of an emergency. So it's not standard practice, but they should always, like, if an item is reusable, which I don't really like the idea of, but it's, I mean, it's,
you guys see her cringe when we said that.
but it is a pandemic, and there are changes, like the importance of sanitizing those materials cannot be overemphasized, and understanding how they're doing that will be really important. So we have more questions. Amma wants to know, advice for those of us who wear glasses, always fogging up and can hardly see.
That's the $1 million question, because mine do the same thing, and I'm standing here going, trying to do like this, and so I'm not touching them. And if somebody knows a trick to that, I'm game to hear it, because my glasses fog up as well, especially when I have my mask on. And then if I have on the shield, I'll get the fogging as well. So I will throw that out for anybody that may have a quick solution, because I have yet to find it. I did the whole shaving cream thing that I saw. I was doing anything and everything, and nothing has worked yet. So I wish I had a good answer for that one, but I've yet to understand it either. My mom wears glasses too, and she was trying to find ways to where her glasses wouldn't fog up either. And so that's a hunt still, that we're still.
So Celeste, I just Googled how to avoid.
Do you change hair cover? Huh? You're muted.
I was saying that I just Googled how to avoid fogging up your glasses with a mask, and there was the Cleveland Clinic, which is a really reputable elite medical institution, actually has a whole article. So I'm going to just share my screen and let's see what they have to say. Oops, wait, hold on. Welcome to my desktop. Okay, so ways to fight the fog. Make sure you have the right fit. So make sure your mask fits securely over your nose. That'll help keep the warm air from exiting up your glasses, up to your glasses. Add soap and water. So I guess soapy water in a soft cloth.
Okay.
This might damage your glasses though, apparently, but you can simply wash your lenses in soapy water and shake off the excess liquid, let it air dry. Use your glasses to seal the top of your mask. That's a good one. So just pull your mask behind your nose and then lock it in with your glasses. Right. Tape it down. But if you do that, please use tape that is made to be used on your skin. Otherwise, you'll have other new problems. And then I don't know what they mean by this. If all else fails, shop around for a solution. I guess apparently there are products out there designed to tackle foggy glasses. I don't know anything about them, but you heard it here from the Cleveland Clinic Health Essentials.
Okay.
All right, back to you, Celeste.
All right. And do you change the hair cover for each patient? I do. Yes, I would recommend that. Because again, it's PPE. You're using it to go into a patient's room to do different things. So you're going to treat it like you treat everything else. Take it off, roll it up, throw it away. It's just anything that you're using to take care of somebody. These things were not designed to do multiple patients. They are designed for single uses. So yes, I would say yes to take it off and change it. Let's see. I've tried purchasing solutions for glasses and can't find anything that works. I agree with you, Miss Donna, because I haven't found anything either. But we just heard from the Cleveland Clinic, so we're going to try their things. Okay. I think, did I answer everybody?
You did. I think this
I
is a great moment to actually share some of the, so what are some of the things you've observed in your work or in other places? What are some of the habits that you've seen, common mistakes, things to look out for? I know you have some.
seen this. No. That's a big, that is a pet peeve of mine. Because I've seen this happen. I've walked into buildings and everybody's trying to talk and take a breath at the same time. So this will be pulled down like this. And I'm like, so anything that's on the outside of here, if you got it like this, you got it on your face now. So please do not do that. We don't want to do this, because if you're not having anything on, again, anything that's on the outside now is just rubbing all over your clothes. So we might want to make sure we don't do this. And again, like I said about these, as fashionable as some people really think these are, they're not. But we want to make sure, again, I re-emphasize about this. And again, I'm not going to untie this because I use this for demonstration, but you want to make sure this is in the back and this is pulled up. We don't want it hanging down here, hanging to the side. This is about protecting you. So take the extra minute or two to make sure that you are doing that right. And again, I just want to emphasize, if nothing else, about your hands. These are your tools. This is what you use to take care of your patients and the residents. So we want to make sure that we are taking care of them, that we are washing them the correct way. And again, your nails, I know when I was in CNA school, my CNA teacher, bless her heart, would say, do this. And she would come by and she would make sure your nails were short. And we've gotten a little lax in healthcare. In some of our buildings and stuff, I'll see people come in, get the nails done, looking nice. And I'm like, whoo, that's a bacteria catching hand right there, because again, as your nails grow or they lift up, and if you're not washing your hands like you're supposed to and all that junk gets up under here. You want to make sure you carry nail brushes. And then on top of that, you don't want to accidentally scratch nobody. You don't want to tear nobody's skin. So it's just, these are your tools to work with your residents and patients. So take, very good care of them. And just, I know a lot of people probably, maybe have watched this and got a little giggle out of it because they're like, I know how to wear PPE. I know what it is. But I wanted to use this to empower you, to show you you are very, very important, and you are worth every single piece of PPE that is available to you. You're worth every piece of it. Make sure you use it. Make sure you use it correctly so that, you're protecting yourself and you're protecting your residents. And we're just trying to get through this crazy time that we're living in right now as best as we can so that, we can get on with our lives. And it's going to be a minute. We're going to be in this battle for a minute. But while we're in it, we want to make sure that we are doing everything that we need to do to protect ourselves.
Words of wisdom.
So somebody died. Home visit. The side will be fully protected, but yes, and that was what I was saying about if you're available or able to do it, go on Amazon. I know right now they do have masks and face shields and the glasses in stock right now. So if you're able to do that, go on there and order you some and just put it away. You don't have to use it right now, but just just to have it, because you never know. If you guys could see to the left of me in the room that I'm in, you would see that there are gloves and masks and face shields and gowns. I work with a team of 10 hospice CNAs, but I'm also responsible for making sure we have all the PPE we need. So I keep a stash here and a stash at my office. So if you're able to do that, I would actually encourage you to go on Amazon and get you some things just in case, because I have a feeling as this surge keeps going up, the supplies are going to start getting fewer and fewer and very thin. So while you have them available, go ahead and try to start getting you some. So.
Wonderful words of wisdom from Celeste. Do we have any more questions?
Was there any more polls? I don't know. I thought there was one other poll. Could be wrong.
Was there another poll, Nelson?
No other polls.
Okay, sorry. I was trying to make up one.
So one thing to add to what Celeste said earlier about the gowns and making sure that it's tied, that the ties are in the back, you absolutely have to do the tie around your waist. There's the one around your neck and the one around your waist. So don't go around, even if you have it in the back, don't go around with it like flapping in the wind because you haven't tied the gown around your waist. These are really important details. They might seem like, oh, it's not that big a deal, but they matter. And your life and your safety matters. And so it's for you and for the people you're caring for. It's to protect everyone.
Yep.
Celeste, do you have any words of wisdom, final parting thoughts for this audience of really engaged people?
Well, one, I want to say again, thank you to everybody who got on here this evening. I hope that you took away something, no matter how small it was. I enjoy talking to CNAs or nurses or DONs or admins, anybody that wants to listen to me, because I'm passionate about empowering CNAs, but I'm also passionate about making sure that we're protected and that we're being cared for as we care for others, because you can't, the saying goes, you can't pour into somebody else if your cup is half empty. And if we feel like we're not protected, we're not going to be able to do a good job to protect and take care of our residents and our patients. So again, I want to empower anybody that was on here to please understand and know you're worth every piece of PPE out there, and to take note, that if you can't find it where you work, look for it somewhere else and order it for yourself. Because sometimes you might have to do you might have to take it into your own hands for the moment until everybody kind of catches up with getting everything. But right now we're in a time where you need to do what you need to do to take care of you so that you can take care of others. And thank you again for everybody joining and letting me be on here, especially Dr. Charlene, for inviting me. I have fun doing these things. I get a little silly, but I want to make sure that everybody engages and enjoys being a part of this because it's just me.
Celeste, you were wonderful. Again, if we had like a clapping track, we'd be clapping, standing ovation. You did a phenomenal job, and apparently Sheena agrees. Sheena says she got on a little late, but great job in info, Celeste.
Yay, Sheena!
If you think Celeste did a great job, put a note in the chat. Give her some props. And while you are doing that, I am going to go back and do one more. Here we go again. Okay, one more moment of thanking the beautiful people that made this happen. The Emergency Preparedness Network is here for you. Minka, Maryland National Capital Home Care Association, CNA Simulations VR, and thank you, this audience, for asking really, really good questions. Celeste, thank you for being such a fun, essentially a fun speaker. And let's take a moment. Excellent presentation, very informative, great information, very useful. We appreciate y'all. Thank you very much, Celeste. Great job. That is what I believe as well. And with that, it's 5:57, so we're gonna wrap up. But again, thank you everyone for joining us. And Celeste, thank you so much.
Thank you.
It's been a pleasure. All right, good night, everybody.
Good night.